Go. Bismillahirrahmanirrahim. Now we will discuss about the human skeleton. So first of all, we will discuss the osteology of the human body. So osteology, our first topic is the humerus. So interior. So now we will first of all discuss the interior view of the humerus bone, and then the posterior view of the humerus bone. So you can see here, this is the head of the humerus, and below the head of the humerus, this is anatomical neck of the humerus bone. This is a humerus head, and this is anatomical head of humerus. So below the anatomical neck of the humerus, there is greater tubercle. So this is greater tubercle, and below the greater tubercle there is lesser tubercle. Between the greater tubercle and the lesser tubercle, between there is intertubercular groove. Between the greater tubercle and the lesser tubercle, there is intertubercular groove. Below the greater and lesser tubercle, there is a surgical neck. This is a surgical neck. So below the surgical neck, we come to the end of this, and then we will discuss the shaft of the humerus. So the end of this is this part we also call medial supracondylar ridge. Medial supracondylar ridge, and this is the lateral supracondylar ridge. And below the medial supracondylar ridge, there's medial epicondyle. So this part is called medial epicondyle, and below the medial epicondyle, opposite side, we have lateral epicondyle, and below the lateral epicondyle we have a capitulum. The capitulum is a part they can join with the radius. So this fossa, we have two fossa. At the interior view of the humerus, we have two fossas. The one fossa is the radial fossa, and second one fossa is coronoid fossa. So two fossa we have, one is radial fossa and one is coronoid fossa. So come to the shaft of humerus. The shaft of humerus, there is major muscle insertion here. So the crest of the lesser tubercle we also call lateral leaf. Lateral leaf is also called is the crest of the lesser tubercle, and the crest of the greater tubercle we call medial leaf. So these 2 points are very important because there is many muscles attached to them. So we come to the posterior view of the humerus. So the posterior view of the humerus, you can see here, this a head, and this is greater tubercle, greater tubercle, yes, and lesser tubercle, and between them is intertubercular groove here. So come to the end, and supra medial, so middle side come so come to the end of the posterior view of the humerus. So this is the medial supracondylar ridge, and this one is medial epicondyle. So come to the opposite side. So this is the lateral supra supraepicondylar ridge, and this one is lateral epicondyle. So below it's in the posterior view of the humerus, we have one fossa. So it is called olecranon fossa. This is very important fossa we have. So we call them olecranon fossa, and below them is a capitulum. So to in the side of the capitulum, near to the capitulum, there is a groove. It's called groove for ulnar nerves. So we know there is a ulnar nerves. So the ulnar nerves is go to the groove of ulnar nerves. So this groove is present and near to the capitulum. So we come to the shaft. The shaft of the humerus, very important because we have there's a deltoid tubercle. So the deltoid tubercle, we have a certain muscle. We will discuss in the next lecture, inshallah. So we will talk about in the next lecture about the all muscle of the skeleton system. So this deltoid tubercle present in the posterior aspect of the humerus, posterior aspect of the humerus. So below the deltoid tubercle is a radial groove for the radial nerves. So these are about the humerus of posterior view and interior view of humerus. So inshallah the next lecture we will discuss and further inshallah we will discuss the all human body osteology, and then myology, and also nerves and nerve supply and blood supply we will discuss, and also all anatomy inshallah we will cover in this type of lecture. So Allah Hafiz. Assalamu alaikum.